Have you ever wondered if that piece of fruit you love so much could secretly raise your risk of a stroke overnight? It sounds shocking, I know. But as a brain specialist, I've seen far too many seniors wake up unable to move one side of their body, all because of hidden dangers in fruits we often consider healthy. According to the American Heart Association and the National Institute on Aging, after age 60, our bodies handle sugar, potassium, and acid very differently. And certain fruits, especially when eaten late at night or on an empty stomach, could become a silent trap for your heart and your brain. So today, let's dive into 8 surprising fruits that might quietly threaten the health of older adults. Because sometimes, the foods we believe are best for us hide the greatest risks. And hey, before we jump into the details, don't forget to like, share, and subscribe to Elderly Health Tips. A stroke isn't just about suddenly losing movement or speech. For seniors, it can be absolutely life-changing. It can steal your independence, leave you struggling to swallow, remember simple words, or even recognize loved ones. Some people end up needing full-time care or living in nursing homes when they'd rather stay in their own house. And it's not just physical. A stroke can leave deep emotional scars too. Many older adults fall into depression, feel embarrassed about needing help, or lose confidence to do the things they used to love like cooking, gardening, or simply meeting friends for coffee. The financial cost can also be overwhelming. Hospital bills, rehab, home modifications, it all adds up fast, putting huge stress on families. That's why knowing the hidden risks and taking steps to protect your brain and your heart matters so much as we age. So let's keep going and look closer at those fruits that might seem harmless, but could tip the scale toward danger for older adults. Let's start with the first fruit, ripe bananas. While ripe bananas taste sweeter and softer, that sweetness comes at a cost, especially for older folks trying to keep their blood sugar stable. It's not just the sugar spike you have to worry about. The roller coaster of high and then crashing blood glucose can leave you feeling wiped out, hungry again too soon, and even cranky. And over time, those spikes stress your pancreas and insulin system, raising the odds for prediabetes and type 2 diabetes. But it doesn't stop there. Older adults often juggle multiple health issues and meds that can mess with how their bodies handle certain nutrients. Take potassium, for instance. Sure, it's vital for nerves and muscles, but too much of it can throw your heart rhythm off balance, sometimes in life-threatening ways. Even a single overripe banana could tip the scales if your kidneys can't keep up. And let's face it, many older folks don't realize their kidney function has declined until something goes wrong. That's why doctors often advise seniors or anyone with kidney issues or heart conditions to watch their intake of high potassium fruits like bananas, especially when they're overripe. It's not about fearing bananas altogether. It's about knowing your numbers, your meds, and your health status so you don't accidentally overload your body. And if you're craving that banana flavor without the sugar rush, blending half a firmer, less ripe banana into a smoothie can still give you the taste you love without quite as many risks attached. A lot of folks think, it's just fruit, how bad can it be? But that's the thing. What's healthy for one person might not be so great for someone else, especially as we get older and our bodies change. Bananas are a perfect example. They're full of good stuff like fiber and antioxidants, but the key is portion size and timing. Another trick I tell my patients is to pay attention to when you eat your banana. Having it right after exercise, for example, is often better because your muscles can soak up some of that sugar to refuel. But eating a whole overripe banana late at night, when you're just sitting around watching television, that's when it's more likely to spike your blood sugar and leave you feeling off. Also, people sometimes forget that bananas vary a lot in size. A large banana can have nearly double the carbs and sugar of a small one, so don't assume one banana always means the same thing. Reading nutrition labels or looking up the average grams of carbs in different sizes can really help you keep better track. And if you're dealing with high blood pressure, don't just cut potassium out completely. Your body still needs it. It's all about balance. The goal isn't to avoid bananas forever, but to fit them into your diet in a way that keeps you safe and feeling good. Above all, listen to your body. Those weird symptoms like a racing heart, sudden weakness, tingling, or dizziness are your body waving a big red flag. Don't try to tough it out or brush it off as just getting older. Give your doctor a call. A quick checkup could save you from a much bigger problem down the road. Next is fruit number 2, known for its very sweet taste, pineapple. Let's start with bromelain. A lot of people have no idea that bromelain is way more concentrated in the core of the pineapple, the tough center part, that many folks used to toss out. Nowadays, with all the whole food and smoothie trends, people are throwing that core into their blenders thinking it's a health boost. Unfortunately, that's where the enzyme is strongest. So even if you're eating just fresh fruit and skipping supplements, you might still be getting a pretty big hit of bromelain if you're not careful. Now add medication into the mix. Blood thinners like warfarin, Eliquis, and Plavix are powerful drugs that help prevent strokes and blood clots. But they're already working hard to keep your blood from clotting too easily. Throw bromelain on top of that, and suddenly your risk of bleeding internally or externally can shoot way up. And the scariest part? You might not even see symptoms right away. It could be something as simple as more frequent bruising, or something much worse, like a dangerous brain bleed. That's why doctors always ask about supplements and diet changes. They're not trying to spoil your fun, they're trying to keep you safe. Then there's the acidity issue. Pineapple clocks in with a pH around 3.2 to 3.5, making it one of the more acidic fruits out there. For younger people with a strong esophageal sphincter, that might not cause trouble. But as we age, that muscle often gets weaker, letting acid creep up into the esophagus. For some, that means classic heartburn, but others get silent reflux, where acid irritates the throat and vocal cords instead, leading to chronic coughs, hoarseness, or even repeated throat clearing. People sometimes live with this for years, thinking it's allergies or just part of getting older, not realizing it's reflux damaging their airways. And here's another wrinkle: nighttime reflux. If acid sneaks up while you're asleep, it can briefly cut off oxygen levels, a condition known as nocturnal hypoxia. You might not fully wake up, but your body registers the drop in oxygen. According to the CDC, that sort of oxygen deprivation raises your risk of stroke by as much as 60% in older adults. Plus, poor sleep quality messes with memory, mood, and increases the speed of cognitive decline. So it's not just a little heartburn. It's a domino effect that can touch every part of your health. But whey pineapple's sugar content deserves a closer look too. It's naturally sweet, sure, but even natural sugars can spike your blood glucose if you're insulin resistant or diabetic. 1 cup of pineapple chunks can contain over 16 grams of sugar. For seniors trying to manage blood sugar, that's not insignificant. And combine that sugar with the fruit's natural acids, and you've got a double whammy for dental health. The acid wears away enamel, and the sugar feeds cavity-causing bacteria. Many older adults already struggle with dry mouth from medications, which means less saliva to help protect teeth. Pineapple might seem innocent, but for some, it's a toothache waiting to happen. So what can you do if you love pineapple but want to stay safe? First, talk to your doctor or pharmacist if you're on blood thinners. Even natural stuff like bromelain can mess with your meds. Limit your servings. The USDA says 1 cup of pineapple chunks contains about 79 milligrams of bromelain, which might not sound like much, but can still be significant for sensitive folks. Pair pineapple with low-acid fruits like cantaloupe or honeydew to help balance out acidity. Avoid pineapple right before bed if you suffer from reflux. Watch for red flags like unexplained bruising, frequent nosebleeds, black stools, or feeling faint. Those could signal internal bleeding. Fruit number 3 is one that's very juicy and sweet: watermelon. See, that's the thing about watermelon, it's delicious, juicy, and feels so refreshing, especially in the summer. But like I always tell my patients, even healthy foods can have a flip side, especially as we age. One part folks don't always think about is the water load. Sure, watermelon is mostly water, but eating a lot of it all at once can flood your system. For older adults whose kidneys might not be working at full capacity, this sudden influx of fluid can sometimes be a problem, especially if they're also dealing with heart conditions like congestive heart failure. Too much fluid can make swelling in the legs worse or even strain the heart, leading to shortness of breath. So while watermelon is low in calories, it's not automatically risk-free for everyone. Another layer is the sugar. People don't always realize how sweet watermelon actually is. 1 cup might only have 46 calories, but it also packs over 9 grams of natural sugar. If you're trying to keep blood sugar steady, eating 2 or 3 big slices can add up quickly. For people with diabetes or pre-diabetes, that can mean unexpected blood sugar spikes, leaving them feeling tired, jittery, or craving even more sweets later. Then there's the bathroom factor. As a natural diuretic, watermelon can make you run to the restroom more often, which might not be a big deal during the day, but at night is a whole different story. Having to get up several times to pee breaks up sleep cycles, which doesn't just leave you tired. Interrupted sleep is linked to higher nighttime blood pressure surges, which can put extra stress on your arteries and increase your stroke risk. And let's face it, navigating the house half awake in the dark is also a fall hazard for many seniors. Plus, dehydration isn't always obvious. Many older folks say, "I don't feel thirsty," so they assume they're fine. But as the CDC points out, the thirst mechanism dulls with age. You could already be dehydrated before your body sends out warning signals. And mild dehydration can sneak up on you faster than you think, especially if you're on medications that also pull fluid out of your body, like certain blood pressure meds or diuretics. Another piece of the puzzle, electrolyte balance. Watermelon contains potassium, which is good in moderation. But eating lots of it in one sitting, combined with increased urination, might cause shifts in electrolytes that leave you feeling weak, lightheaded, or even contribute to heart rhythm problems in folks who are already vulnerable. So if you love watermelon, and let's be honest, who doesn't? Here's what I tell my patients. Eat it earlier in the day, not late at night, so you're not losing fluids during sleep. Stick to moderate portions. The USDA says 1 cup of watermelon contains around 139 grams of water, but eating several cups at once can overload your bladder. Drink water steadily throughout the day. Don't wait until you're thirsty to chug it. Watch for signs of dehydration like dark urine, dry mouth, dizziness, or rapid heartbeat. If you're on diuretics or blood pressure meds, talk to your doctor about safe fruit intake. Fruit number 4, grapes. Grapes are what I call a sneaky sugar bomb. They're bite-sized, easy to eat by the handful, and they don't feel indulgent. But that's exactly the problem. Most people don't stop at just 1 cup. You're watching television, popping them in like popcorn, and before you know it, you've eaten 3 cups, nearly 70 grams of sugar in one sitting. That's more than what's in a slice of cake. What's worse, because grapes have a high glycemic load, they raise blood sugar quickly. That sudden spike can leave you feeling foggy, tired, and even shaky if your insulin response isn't working well. And over time, these constant sugar rushes wear out your pancreas, damage your blood vessels, and leave you wide open to complications like stroke, heart disease, or nerve damage. Plus, sugar spikes don't just mess with your blood, they mess with your brain too. Research has shown that fluctuating blood sugar levels are linked to cognitive decline, especially in older adults. That brain fog you feel after snacking on something sweet, it's not just in your head. Over time, it could contribute to memory issues and increase your risk of dementia. Now, let's not forget that grapes, like many fruits, also contain natural acids. While mild, these acids, combined with the high sugar content, can be rough on tooth enamel, especially for seniors who may already have dry mouth from medications. Less saliva means less protection for your teeth, and those sugars sit longer, feeding bacteria that cause decay. So what seems like an innocent snack could be quietly working against both your heart and your dental health. So what's the takeaway here? Grapes aren't bad, they're just powerful little fruits that need to be treated with a bit of respect, especially as we age. I always tell my older patients, it's not about cutting everything you love out of your diet. It's about learning how to work with your body, not against it. Start small. A half cup serving of grapes is a safe place to start. It gives you about 15 grams of carbs, which fits nicely into the American Diabetes Association's guidelines for a light snack. And don't eat them alone. Pair those grapes with a slice of cheese, a spoonful of Greek yogurt, or a few almonds. That added fat or protein slows the sugar from flooding your bloodstream all at once. Also, when you have a choice, go for the darker grapes. Concord, red, or black varieties tend to be higher in antioxidants like resveratrol, which support heart health, and they usually have a bit less sugar than green grapes. They still taste sweet, but they're a better option if you're watching your sugar. One of the biggest mistakes I see: snacking all day long. A handful here, a few grapes there, while cooking, watching television, or working on the computer, and suddenly you've eaten 2 cups without realizing it. Instead, treat fruit like any other carb-containing food. Measure it out, eat it mindfully, and give your body time to respond. And don't ignore the warning signs. If you're feeling more tired than usual, getting dizzy after meals, noticing blurry vision, or finding yourself suddenly cranky or shaky, those could be signs your blood sugar is out of whack. Talk to your doctor, track your symptoms, and don't be afraid to adjust your habits. Fruit number 5 is a sweet and fragrant tropical delight: mango. One of the problems with mangoes is how easy they are to overeat. 1 cup of sliced mango already gives you nearly 12 teaspoons of sugar. But who stops at 1 cup? A smoothie with mango, a bowl of fruit salad, a tropical salsa, it all adds up fast. And because it's natural sugar, people assume it's harmless, but your body doesn't know the difference. Whether the sugar comes from a soda or a mango, it still hits your bloodstream the same way. Plus, mangoes are super ripe when they're sweetest, which means they also have a higher glycemic index. That means they're absorbed quickly, spiking your blood sugar faster than fruits with more fiber or less sugar. For older adults, especially those with insulin resistance or on the edge of diabetes, that quick spike can trigger a dangerous cascade of inflammation and vascular damage. Now here's where it gets even more complicated: medication interactions. Mangiferin, that plant compound found in mangoes, has gotten a lot of attention for its antioxidant effects, but not everyone realizes it can mess with how your liver breaks down certain drugs. If your liver slows down metabolism because mangiferin is inhibiting the cytochrome P450 system, medications like warfarin, statins, or beta blockers can stick around in your bloodstream longer than they should. That can turn a safe dose into a dangerous one. And here's the catch: these changes don't always show up right away. You might feel a little more tired, or bruises show up more easily. Maybe your heart feels like it's skipping beats, or your blood pressure seems off. Most people wouldn't blame the mango. But for someone over 65 with a delicate balance of medications, even a healthy food can quietly tip the scale the wrong way. So if you're a mango lover, and let's be honest, who isn't? You don't have to give it up completely. But you do need to be smart about it, especially if you're managing your blood sugar or taking prescription medications. This is what I always tell my patients who ask me if mangoes are safe. First, portion control is everything. Half a cup of mango is a sweet, satisfying amount that won't send your blood sugar through the roof. It's easy to go overboard when you're slicing up a whole fruit, so try measuring it out ahead of time or even pre-portion it in the fridge so you're not tempted to nibble your way through a bowl without noticing. Second, don't treat mango like a daily dessert. Think of it more like a once-in-a-while treat, something to enjoy mindfully, maybe once or twice a week, especially during mango season. That way, it still feels special and you're giving your body time to reset in between. If you're on any prescription, meds especially blood thinners or heart medications, this part is crucial. Tell your doctor how often you're eating mango. Just because it's a fruit doesn't mean it's neutral. Natural compounds like mangiferin can build up and interfere with how your body processes certain drugs. It's not about fear, it's about giving your care team all the information they need to keep you safe. Also, consider pairing mango with a bit of protein or healthy fat Greek yogurt, a few walnuts, or even a slice of turkey breast. That combination helps slow down how fast sugar hits your bloodstream, which can reduce those post-snack crashes or spikes that leave you feeling jittery or drained. And finally, don't ignore your body's signals. If you start noticing things like unexplained bruises, frequent nosebleeds, fluttering heartbeats, constant fatigue, or that lightheaded off feeling, don't brush it off. Those symptoms might not seem serious at first, but they could be signs your medication levels are too high or that your body's not metabolizing things properly. Fruit number 6, pear. And that's the thing about pears, they're delicious, crisp, and feel like such a healthy choice. And they are healthy. But like I always tell my patients, even good things can backfire if you don't pay attention to the details. One of the sneakiest issues with pear and other high fiber fruits is how easily we can go overboard. People hear fiber is good, and suddenly they're eating pears, oatmeal, bran muffins, chia seeds, and beans all in the same day. The problem is your body and your medications might not be able to keep up. See, soluble fiber like pectin acts like a sponge. It doesn't just soak up cholesterol or sugar, it can also latch onto medications in your gut. And for older adults who are often on multiple prescriptions, this can be a bigger deal than many people realize. If your blood thinner or cholesterol medication gets trapped and flushed out instead of being absorbed, your protection against clots, strokes, or heart attacks could be reduced without you even knowing it. It's also important to remember that fiber slows digestion. That's usually a good thing, lower sugar absorption, smoother digestion. But for medications that need to be absorbed quickly to work properly, it's not so great. Imagine taking your statin or blood pressure pill with a big pear and a bowl of high fiber cereal. You might think you're eating super healthy, but you could be lowering how much of your medicine actually makes it into your bloodstream. Another thing people don't always think about is bloating and gas. Eating lots of pears and other fiber-rich foods can leave you feeling uncomfortably full or gassy, especially if your gut isn't used to it. For seniors who may already struggle with slower digestion, that bloating can be downright miserable and may discourage them from sticking to healthy habits altogether. So what should you do if you love pears? The good news is you don't have to avoid them entirely. Here's my advice to my older patients. Spread your fiber out. Don't load all your fiber into one meal. Spread it across the day so your digestive system and your medications can keep up. Time your meds carefully. If your doctor says it's okay, try taking your medications at least an hour before or 2 hours after a high fiber meal. That gap can help ensure better absorption. Watch your portions. Half a medium pear is a great serving size if you're worried about fiber interfering with your meds. Listen to your body. If you're feeling more bloated, gassy, or notice changes in how your medication is working, talk to your doctor. Fruit number 7, pomelo. Grapefruit is one of the healthiest looking fruits out there, full of vitamin C, fiber, and antioxidants. But it's also one of the most dangerous fruits when it comes to drug interactions. Let me break it down. Grapefruit contains powerful compounds called furanocoumarins. The FDA, 2022, has confirmed these compounds block the enzyme CYP3A4 in your intestines, and that's the enzyme responsible for helping your body safely process and clear many medications. When grapefruit blocks this enzyme, more of your medicine gets absorbed into your blood than your doctor intended, sometimes 2, 3, even 10 times more. That's not a small issue. The FDA lists grapefruit as the #1 fruit for drug interactions, affecting more than 85 different medications. These include statins like simvastatin, atorvastatin, and lovastatin used to lower cholesterol, calcium channel blockers like amlodipine or felodipine for blood pressure, blood thinners like rivaroxaban, Xarelto or apixaban, Eliquis, heart rhythm drugs like amiodarone or drondarone, certain antidepressants, anxiety meds, and even some painkillers. A review in the Canadian Medical Association Journal reported that even 1 glass of grapefruit juice per day could increase blood levels of some statins by up to 700%, leading to severe muscle breakdown, kidney failure, or liver damage. Similarly, research cited by the Mayo Clinic has shown that people taking calcium channel blockers can see blood pressure drop dangerously low when combined with grapefruit, risking dizziness, fainting, and falls a huge concern in seniors. It's not just juice either. Even half a fresh grapefruit or a few grapefruit segments can be enough to interfere. The problem is, Furanocoumarins stay active for up to 72 hours, so it's not as simple as just wait a day. The National Institutes of Health, NIH, warns that older adults are especially at risk because they're often on multiple medications, and their bodies process drugs more slowly with age. So what should you do if you love grapefruit? Here's my advice for patients. Always ask your doctor or pharmacist whether your meds are safe with grapefruit. Don't assume it's harmless just because it's fruit. Check your medication labels. Many now say, do not take with grapefruit. If you see that, follow it strictly. If you crave citrus, try safer alternatives like oranges, clementines, or tangerines. These have much lower levels of furanocoumarins. Don't rely on timing alone. The effects of grapefruit on drug metabolism can linger for days, so simply spacing out your meds isn't always enough. Watch for danger signs: unexplained bruising, muscle pain, dizziness, irregular heartbeat, or severe fatigue. These could mean your medication levels are dangerously high. Let's move on to fruit number 8, apple. Most people think of apples as the poster child. For healthy eating, an apple a day keeps the doctor away, right? But when you're taking blood thinners or have heart issues, how you eat that apple and how many actually matters more than you might think. The truth is, quercetin builds up. If you're having a couple of apples a day, plus red onions in your salad, some berries for dessert, and maybe even a supplement or heart health drink with added flavonoids, you could be stacking up quite a bit. And while quercetin on its own is beneficial, when mixed with medications that already thin your blood, that combo can quietly push things into dangerous territory. Let's say you're on warfarin. Your doctor's carefully adjusted your dose based on your INR levels to prevent clots without risking a bleed. But then, you start eating more applesauce, switch to juicing, and leave the peels in, where most quercetin lives. Suddenly, your INR creeps above 3.5 or even 4.0, and you don't know why. Maybe you bruise more easily, or your gums bleed when you brush your teeth. Maybe you feel lightheaded and chalk it up to age or dehydration. But really, your blood's too thin, and that's no small thing. And remember, it's not just about warfarin. Newer anticoagulants like Eliquis or Xarelto don't require routine INR testing, but that doesn't mean they're immune to interactions. In fact, because you don't monitor them as closely, it's even easier to miss subtle signs that your blood might be thinning too much. That's why I always remind my patients to think about their whole plate. Yes, apples are healthy, but healthy doesn't mean harmless. Especially when you're over 60 and managing multiple medications. I'm not saying you should ditch apples, but you should talk to your doctor if you've recently changed your diet, especially if you've increased your fruit intake, added supplements, or started juicing. And if you're a big apple lover, a few tips I give my patients. Stick to 1 apple a day, preferably organic, with the peel. That keeps you in the safe zone while still getting the fiber and antioxidants. Avoid apple peels in concentrated form like in smoothies, juices, or supplements unless cleared by your doctor. Space out your intake of other high quercetin foods like onions, kale, and berries, especially if you're on blood thinners. Watch for signs of overthinning, easy bruising, prolonged nosebleeds, pink in the toilet after brushing, or unexplained fatigue. So, what have we learned today? Bananas, grapes, mangoes, pineapples, watermelon, pears, apples, and yes, even grapefruit can all carry unexpected risks for older adults. Not because they're bad, but because our bodies change. After 60, your heart, brain, liver, and kidneys react differently to sugar, fiber, acids, and certain natural compounds. One small fruit can tip the balance when combined with medications, age-related conditions, or nighttime habits. That's why awareness is everything. So don't fear fruit, just eat smart, know your meds, watch your portion sizes, listen to your body, and most importantly, don't make assumptions based on what used to work when you were 30. If today's video helped you think twice about your next evening snack or made you go, wait, I had no idea, then it's doing its job. Before you go, don't forget to like, share, and subscribe to Elderly Health Tips. Because staying healthy doesn't have to be confusing, It just takes the right information and the right people looking out for you.